will start to notice shedding again. And for those folks, they would need to come in after year 1 for maintenance. But those are 3 things. So everybody who comes into the office is not a surgery candidate when they arrive.
Right.
And they may be just concerned that they're starting to notice a receded hairline, and we have to stop it from getting worse. It's very important to stop progression.
Yeah.
And that's something that actually that does get brought up in a lot of the information on transitioning. Is if you're considering transitioning, one of the things that you should look at early is if you're going to be serious, if you really think you're going to transition in a few years, go do something about your hair loss.
Right.
Go put it on pause.
Yeah.
That's great.
Because it's not going to hurt either way.
Right.
But it's a lot easier to put it on pause while you're considering it than to try and fix it
Afterwards. It's much easier to keep hair than it is to replace it. I mean, that's just very simply the way it is. So if people are considering that, it's very important, as you described, to stop the progression. It's really important.
And obviously, this is something that's relevant to everybody out there. It's not just us. Obviously, for people that are transitioning, and for myself, it was a huge thing. But this is something that happens to everybody.
Yep.
How did you discover hair transplantation? How did you learn about it originally? I don't remember what you told me.
Well, I found it on the internet.
Okay.
And it was funny because, there was a time back in the early days before I transitioned, there was a point in my life where I knew that I had to transition. And I was looking at everything, all my options and stuff, and I was convinced I couldn't do it. I was absolutely convinced I couldn't do it. And one of the things that I saw as a possible huge problem was, what am I going to do about the hair? I can't go through the rest of my life wearing a wig. So I started doing a lot of research on the internet, and I found a bunch of information about hair transplantation, and I found your website, in fact, and you were fairly close by, so I went to see you, and that initial consultation, obviously, I walked out of your office with a big smile on my face. I really did, because it was one of those things that I walked out of there going, oh my God, we can fix this.
I can do something.
And that was so important. And obviously it takes a long time, but wow.
So there's a lot of it.
So there's a lot of it, yeah. But it's one of those things that's it's well worth the wait.
So in the transgender transition website community, I mean, is it described?
You will find information
Okay,
on hair transplantation.
Learn more about that.
It has gotten actually a lot better over the years as more people have been brave enough to step out and talk about their experiences. A lot of the folks that had media access started pulling together information, and nowadays there's several very good sites out there that give you information on pretty much anything in the process that you're interested in. Yeah. And hair removal is one section, and hair restoration is another.
Yeah.
As long as they don't mix up the paragraphs.
It's such a shame that we can't take the hair that we're losing and put it. But that was the question I had for you, by the way. I can't do that. I had heard somebody wrote something, and I don't know if there was any truth to this, that there was a possibility of taking body hair and transplanting it to your head, and that some of it would actually take on the characteristics of scalp hair.
One thing that I do, for example, I do eyebrow transplants. A lot of people have thin eyebrows, or they want to overpluck them, whatever the situation is. So I can transplant again. I take it from the back of the head and transplant. And what you describe is an amazing phenomenon. The body over time transitions, and those hairs will not grow long, because initially they'll grow as long as they are on the back of the head. So I always tell patients before they have to trim their eyebrows, right? They have long eyebrows. But over time, they won't grow long anymore. As far as body hair transplant, people are doing that. The problem with body transplant, though, is that the characteristics of body hair are very different from scalp hair. Chest hair, for example, back hair, pubic hair, we've transplanted from pubic areas. We've also transplanted to pubic areas. I do that not most commonly, but not uncommonly either. And in the hairs, for example, from the chest or the pubic area, they just don't have the characteristics. They don't have the same cycle of growth, so they grow for a shorter period of time and then fall out. They don't grow to a significant length. So that's the area of last resort. We really try to use light hair for transplantation. But you're right, it is something that can be accomplished.
It's interesting. I think I had asked you at one point about eyelash transplants. That's another one I've been hearing about.
Well, eyelash transplants can also be done. There are a couple of different techniques. They haven't been scientifically vetted yet, so a couple of doctors are doing this, simply make a little niche out of their practices. But the long-term results haven't been really vetted. But you know, I have one of my colleagues from Brazil, and that's what he teaches us at our meetings, and it's a very elegant little procedure. Do you know about Latisse now?
Well, I was going to ask you about that. I saw something about that, and I wanted to ask you about that because I'm very interested in that.
I have Latisse in my office. Latisse just became available probably about 9 weeks ago. It's a product made by Allergan. The same people do Botox, and I do Botox and fillers as well. And it's a really cool little easy thing to do, and I've started to see results. I've had 3 of my staff members use it, and I've had about 20 patients use Latisse. And what it is, it's a bottle with eye drops that you don't place in the eye, but you actually put on the upper eyelashes. You have to take makeup off, you can't wear contact lenses, and you put 1 drop on an applicator and just swathe the top eyelash, and then you do the same thing every night. It takes about 8 weeks to start to see a change, and what it does, it's been scientifically double-blind study proven to make the eyelashes longer, thicker, and more pigmented.
Wow.
So it's really, and I'm starting to get positive, not only observation, but reports from patients saying, hey, it's starting to work, it's starting to work. It's done every night for 16 weeks. And at the end of 16 weeks, that's the end of the treatment time frame. And what you then do is maybe once a week you give it just to maintain the results.
Wow.
So it's a pretty cool thing. Very, very few side effects. It's
Very
really
easy to do.
Very easy to do. If you can put, an eyeliner on, you can do it. It's simple.
Okay, so I'm going to have to come see you about that.
Yeah, we have it. Geez, I would have brought a bottle.
Yeah.
But that's it's something that's non-invasive.
Right.
It's really nice. It's really nice.
Yeah.
We've transplanted hair. See, the beauty of transplant, you have the genetic predisposition of this hair to stay forever.
Right.
So, for example, people who want facial hair, we can transplant in mustache and beard. People with cleft lips, for example.
Right.
And just for cosmetic purpose, I have a patient who had a mustache that only grew this far, and he wanted to have the Fu Manchu extension. We transplanted it, and they grow beautifully. So it's just one of those things.
And he has to shave it and trim it. And
Yes, I said, we're trying to get rid of all this hair on our faces, and that's what he's doing.
I know.
But 1 out of 2 men have male pattern baldness. Is a very, very common condition as
I
well.
know.
yeah.
I know.
And so there's a lot of need out there. And we can lose weight if we try, and hard enough we can lose weight. But people don't have control over their hair.
Yeah.
And they don't think they can do anything. And one of the things about my field, this is my 20th year in practice this month, in fact.
Wow.
And it's changed, but we still have to get public relations out there because people still don't know what I can do for them. And that's why I really appreciate having me here tonight, because it really gives the general public information that or corrects misinformation about what transplantation is all about.
Yeah. And we love to do this kind of stuff because we tend to we like to sort of periodically try to inform our audience of what we're about and who we are, what we do, and basically what we've had to go through. Because one of the things that I think, people think, oh, this is just, they did this on a whim or something. Yeah. It's like, oh, no. If you knew the things that we've had to go through to make this happen, you'd realize nobody does this on a whim. Yeah. But so we have to try to educate everybody on the kind of stuff that the procedures we have to undergo. And certainly what you do is probably the easiest procedure I ever went through. Easy for me, not for you, but for me.
Yeah.
And